Good morning. My name is Maggie Reri. I'm the CEO of Tifa Research, and I'd like to welcome you to today's webinar. This webinar is about COVID-19. We'll be discussing issues to do with the urban poor, and I want to thank you very much for creating time to join us today. What I'd like to do as a start is just give you a background to the reason why we conducted this particular survey. So between myself and Dr. Tom Wolf, who is one of the panelists, we had a brainstorm and came up with the concept of doing a webinar, a survey targeting the urban poor. One of the things that has happened to us who are living in Nairobi is that there's been a curfew that has been put in place from 7 p.m. onwards up to 5 a.m. And therefore means that people cannot move from one area to another. The other thing that has happened is that we are not able to move from one county to another unless you have permissions to move around. Now, what is happening also is that the economy has been affected and quite a number of people have lost their jobs. But when we talk about those kind of issues, and we're talking about them in the general population, the effects are not as adverse as when you look at them when you're looking at the urban poor. Now, if you look at the urban poor who are living in Nairobi in areas like Kawangware, Mukuru Ajenga, Mathare, etc., they actually depend on moving from where they live and they go to various places to work. It could be to factories, it could be to our homes to work. But the current situation with COVID is that they are vulnerable in terms of they're not able to work or earn a living as much as they would like to. And we felt that perhaps it's an opportune time for us to measure the impact of COVID on their lives. So there's been a lot of conversations, but for the very first time, we have data that shows the impact of COVID on their lives. So the survey is covered a lot of things. But basically today we want to only focus on several topics. And the topics we'll be covering is issues to do with human rights, issues to do with compliance. Are people complying with the regulations because they fear the virus or the police? We're going to be talking about the social economic impact. We're going to be talking about the survey and the value of the data, over and above many, many other things. I just also want to mention to you that although Tifa has conducted this survey and we published a report last month, we are currently in phase 2 and we're collecting the second round of data, and the report should be out next week. And it will be quite interesting to see, has the situation worsened or improved, or what are the changes in the current survey based in the last 3 weeks? Has there been any improvement? And that's what you want to find out. We have had a lot of reports and confirmations that the virus is going to be with us for a long time. And it's our intention to continue tracking the impact of COVID on the urban poor, and if possible, would like to expand the scope to beyond Nairobi to other counties and even nationally. We feel that when stakeholders have data, then they're able to make the right decisions and they are able to come up with the right policies that will guide the right interventions for the target group that we are researching on. I'd also like to really appreciate the organizations that sponsored the first survey. This was the Hans Seidel Foundation and the Nation Media Group. They put in the money for the first round, and we really want to thank them for that. And it was because of that, then we were able to publish this report and even have this webinar. So thank you very much, Nation Media Group and Hans Seidel. So what I'd like to do now is introduce the panelists. We have a very strong set of panelists. And panelists, after I introduce you, I'd like to request that you wave so that the audience can know who I am introducing. So I'll start by introducing Demas Kiprono. He's a campaign manager, safety and dignity at Amnesty International. For those who don't know, Demas is a lawyer and an advocate of the High Court of Kenya. He has also worked in local and international human rights organizations, such as Article 19, Eastern Africa, Kenya National Commission on Human Rights, and now Amnesty International. Over the years, he has worked on groundbreaking human rights litigation on a wide array of issues, including police brutality, accountability, and extrajudicial killings. He's also a columnist on The Standard, and I would encourage you to look out for his article because they are very interesting. So Demas, if you can wave to the audience so that they see who you are. Thank you very much. I'd now like to introduce the second panelist, and his name is Dr. Danvers Makori. He is a commissioner with the National Cohesion and Integration Commission. He chairs the Finance and HR department in the commission. Prior to working in the commission, he worked as a consultant and the finance CEC to Nairobi County, so he understands all the issues to do with finance at the county level. He's also worked as the head of service delivery unit in Nairobi County. And over and above that, all this experience has earned him an in-depth understanding of the city, both from a policy and a ground-up approach. And when I was talking to Danvers about being part of this webinar, and he was like, you know what, if you're talking about Nairobi, you're talking about the urban poor, you're talking about social economic impact, that is something that he lived with and understood for a very long time. So Danvers, thank you very much for joining us. Then our other panelist is Dr. Tom Wolf. Dr. Tom Wolf does not need introduction to many because over the last years when he's been in Kenya, he's been on TV releasing a lot of opinion polls on issues to do with Kenyan politics and other issues. Currently, he's an independent consultant working for Tifa Research. To be honest, I have known Tom for over 10 years. Initially, when I was younger and a young researcher working for the company that we met at, Tom was instrumental in guiding me, challenging my line of thinking in research, and I'm really, really happy to have him on board. So Tom is a colleague, a partner, and I know he has a very strong passion for research. Karibu, Bwana Tom. Good. So now that we know who the panelists are, what I'd like us to do right now is basically start the session with Dr. Tom Wolf. Being the research guru he is, he would like to talk about the research that he did, an overview, analysis, and some of the importance of cross-tab analysis so that you're able to get more out of the data. So, Dr. Tom Wolf, the floor is yours.
Thank you, Maggie, and also greetings to our other panelists. I'm pretty new at this high-tech medium for webinars, so if I have problems, I'm sure someone will come to assist me. I don't want to speak for too long at the beginning to allow the panelists to dig right into the data, but a couple of other preliminary points I should add to what Maggie has said. She already mentioned that the second survey of this nature is underway as we speak. Hope to finish it in the next couple of days. And we were very eager to have it begin and also, if possible, conclude by Saturday or whatever day the president is going to make his very eagerly awaited announcement about the two restrictions that Maggie referred to, which are applying to Nairobi, that is the curfew, especially its hours of duration, as well as the travel restrictions, because to the extent, as Maggie said, that we wanted to see after 1 month how much conditions have changed for our targeted sample, this section of the population of Nairobi's poor, we wanted to be able to use as many of the questions from the first survey as possible so that our results would be comparable. We are not entirely certain that all the interviews would be completed by Saturday, whatever time the president is going to make that announcement. We don't know what time that will be, nor do we know, of course, what he's going to say. If he says that all of the current restrictions now in place will continue as they are, then of course we wouldn't be under such pressure to finish the last remaining interviews. But we hope to get enough of the data in from the second round so that at least the bulk of the responses would be comparable. Also in relation to that, we've been able to increase the sample size slightly for this second round, as is seen under the methodology details with the first round release. We were only able to interview or include 356 respondents, from these various low-income areas in Nairobi for the first round. And the margin of error is shown there at plus or minus, I think, 5.2. But that means that if we're going to make comparisons within the sample, based either on demographics, such as gender, or employment status, or a monthly income level, or marital status, or whatever, those margins of error will go up. And of course, we can also make comparisons within the sample based on responses to particular questions. For example, as you may have seen, we have one question: how worried are you about contracting the virus? And we had 4 categories of responses, from very worried all the way down to not worried at all. And when we split a sample of 356 into 4 categories, for each of those categories, of course, the error margins are higher. So we're aiming to increase the sample size in this current survey by 150 at least, not a bit more, so that especially for the intra-sample comparisons, the results will be slightly more robust in statistical terms. I mean, obviously, if we had more funding, more financial support, we could have increased the sample size to 3, 5, or 1,000. Sorry, or 10,000 or whatever. But resources are always limited in such undertakings. So that's sort of just background on the methodology and where we are with the current survey. And as Maggie said, we hope by the end of next week to have gone through the data and made releases. And these releases, as I was suggesting for the second survey, will be both a picture of where our respondents are at the time of the survey, as well as comparing these results to the ones that we obtained about a month ago. And I want to end by showing a couple of slides from the presentation, which you can also access on the TIFA website, to illustrate a couple of points that I was making about comparisons within the sample. And before I do that, let me just say that we make these comparisons for basically 2 broad reasons. One is to illustrate with figures that even within this rather restricted range of the sample, that is Nairobi's low-income areas, there are differences, both in the experiences that our respondents report, such as the prevalence of police violence in their locality, as well as their views or their opinions about things, such as how worried are they about the virus, and so on. And clearly, because of the small sample size, we're not in a position statistically to make a comparison between the situation on the ground, say, in Mathare and Huruma, or between Mukuru-Wanjenga and Kibera and so on. The overall sample is just too small. But with regard to these thematic issues, worries about the virus, attitudes to the police, and so on and so forth, we do make those comparisons. So, as I say, the first point is to illustrate that even within this restricted sampling targeted range of low-income areas, our respondents are reporting differences, and they show differences. I mean, the most obvious one, of course, is gender. We have men and women everywhere in the world, but on many other aspects too. The second point is that with regard to these contrasts which appear in the data, such as how worried people are, how much they've been affected. Whoops, we went to a slide, but that's okay. I assume people are still hearing me. Yes, I can see the faces there. It raises the question is, why do people have these different experiences, or why do they have different views on particular issues? Now, analyzing the causes, the reasons for such variations is a very demanding and complicated research task. And some of them cannot be fully answered from this data. We would have to go back and further explore these issues in more qualitative investigations. But I just wanted to give a few examples here. And the first one that's on the screen is the measures that people have adopted, and that's correlated with how they answered the question as to how worried they are. And you can see that for all but one, and that is using a hand sanitizer, those who are very worried are statistically slightly, only slightly, but measurable statistically, more often engaging in these protective measures. I would take a conclusion from this slide that whether people are very worried or not worried at all, they are still, by and large, undertaking these protective measures at the same rate because they know the virus is out there. Whether they think the chances are high or low that they will be affected, we're still quite in the early stages. And remember, a month ago when we did the survey, we only had about 1,000 confirmed cases, and I believe only about 24 deaths. So it was very unlikely that any of our respondents, we have this in the data, but we won't go into that now, that people actually knew anyone who had been tested and found to be positive, let alone anyone who had died. Those people just were not there. Now I want to go to the next slide if I can figure out how to do that. Whoops, sorry. We did that one. Okay, here we are. Let me just skip this for the time being. Go to the next one. Okay, here, when you look at this slide, asking people, have they been able to save anything from whatever income they're making? And this is just asking those people who reported they were still making some income, whether from formal employment or from self-employment, Juakali sector, and so on. Hardly anyone, since the restrictions came in place, have been able to save anything. But when we make a division between those who are making more or less than 10,000 shillings a month, we see that the group that's making a bit more, 4 times, that's 400%, a difference of 1% versus 4%, are now able to save at least something. The numbers are very, very small, but nevertheless, we do see this correlation that's measurable on the basis of income and savings. Again, this shows this even better, where we have a difference between 7 and 3%, as opposed to this one. This is income, which people were making before.
Dr. Thomas, we cannot hear you.
Will now begin to improve, and that's shown in this chart in green. And the red is the worst is yet to come. And you can see on the chart, on the bar chart on the right-hand side, a very, very strong correlation. People who do research and are interested in statistics are always happy when they see such a correlation, however sad the reality might be out there. But if you look at the left bar, those who are very worried are far more convinced that the worst is yet to come, as opposed to those who are not worried at all. I think it's 68% versus 21%. So more than 3 times as many of those who are very worried are expecting things to get worse, as opposed to those who are not worried at all. Now, as I said before, to find out why certain individuals are more worried than others, what explains this? Is it based on information? Is it based on reading of scientific papers about COVID-19? What actually determines these levels of worry or concern is an analytical task which must go beyond the confines of this survey. But nevertheless, it's something we could explore. 1 or 2 other examples, just on the basis of gender. And these results reflect gender roles that are determined by culture, not just in Kenya. And just two examples. When we ask the question, what's the main challenge that you are expecting if the virus crisis continues? On the far left, having enough to eat, we see quite a higher percentage of women, females, 67%, as opposed to men, 49 saying this. And we can deduce from this the widely prevalent pattern that women are more likely to be the caregivers in the home, more responsible for putting food on the table each night. In contrast to the third from the left, paying of rent, where we have 5 times more men, 10%, as women, just 2%, saying that will be the main challenge for them. And remember, this was a single response question. So it's not that only 6% overall of our sample are worried about paying rent. They could only give one answer and identify that priority. So there we have a clear correlation based on the demographic of gender. And maybe the last one, because I'm talking a bit too much, and this maybe will lead more to the discussion of human rights. We did a correlation between a perception question, that is, are police using force to enforce the curfew in your area? That was a yes or no question. The red is yes, the green is no. Then we asked an attitudinal or opinion question, and that is, do you believe the police are respecting human rights in enforcing the curfew? And while we don't see a contrast of 0 to 100, it's very, very clear that among the people who think that who say the police are not using force, only 19% think they are not respecting, say that they are not respecting human rights, but 81% say they are not respecting human rights among those who say that they are using force. So clearly there's a correlation in people's minds that the use of force by the police in terms of being a violation of human rights is much more prevalent in places where the police are using force. Now, I would have to defer, I think, to my panelists, and I'll stop here. What would explain why the police are using force, or more likely perceived to be using force, in some areas than others? For people who know these low-income areas well, are people in certain of them more law-abiding or more fearful of the police than others, which would mean the police would not have to use the force if from 7 o'clock at night, not a single person is seen on the streets? As I was saying at the beginning, and I'll end with this, even if we did our sample selection within areas that are known to be low income, and that's somewhere between 55 and 60% of Nairobi's total population, if I've got my data right from the National Bureau of Statistics. We are not assuming that conditions on the ground are uniform in all these areas. So let me stop with that, turn things over to the panelists, who I'm sure will help to put much more meat on the bones of this sort of broad outline of the survey. Thank you.
Thank you very much, Dr. Tomo. I've also seen a question that has come through the chat. I'll just like to read the question. So somebody's asking, how did we do the study in Huruma, Kibera, Mathare, Korogosho, Mukuru, and Jenga, Kawangware during such a period as this where there's COVID? And I'd just like to say that what normally happens with the research agencies, including TIFA, is that we do a lot of face-to-face surveys, and then the respondents are then requested whether they could be contacted on phone. So we had a database of respondents living in this area. So the researchers did not break the social distancing law, and therefore we did the interviews telephonically. Thank you very much, Dr. Tom. Now let's move on to the next area. And I'd like to talk about issues to do with police brutality. And before we get to that, I just want to play a video, if you'll allow me. And just hold on 1 minute. I just want to play it.
The Independent Policing Oversight Authority, IPOA, says it is investigating 21 deaths linked to police officers enforcing the curfew order in the country. According to the authority, last night's incident where a homeless man was allegedly shot dead by police in Mathare 3C area is among the 87 incidents which have been reported to them and which are still under investigation. This as the Director of Public Prosecution approves the arrest and prosecution of a police officer, Duncan Diema, over the killing of a 13-year-old Yasin Moyo at Nairobi's Huruma Estate.
Mathare 3C area residents burning tires and barricading roads on Monday night to protest the murder of a homeless man, only known as Vaite, allegedly killed by police officers enforcing curfew orders. His body lay by the roadside as the angry residents blocked the police officers from collecting it. Militant this morning, debris of last night's protest told the story of their anger. Tension was still palpable, even as an easy calm reigned.
Siku mbili zilizopita wamekuwa wakitupigia risasi huku hadi tufunge makazi. Ili hali hata saa moja haijafika. Corona hatuijui sana. Acha tuuliwe na njaa, lakini sisi tuuliwe na bullets. Hii ni makosa kubwa sana.
Wanaua mzee ambaye hana hata hatia. Ule ni chokora. Anajitafutia riziki yake.
According to the Independent Police Oversight Authority, IPOA, 21 Kenyans died in the hands of police officers enforcing the curfew directive. The latest incidents include the death of Collins Kipchumba and Boniface Kiprotich, who was shot dead in Tabolwa, Nandi County. The killing of 3 family members in Kwale County over the weekend, as well as shooting of a woman at a police block in Emali. 31 other Kenyans are recuperating in hospitals and at home after they were assaulted by police officers over the last 2 months while enforcing the dusk to dawn curfew, the authority says. These are among the 87 complaints against police reported, ranging from deaths, shootings, harassment, assaults, robbery and sexual assault. Human rights activists who claim the number is more than the reported cases want the government to ensure that all citizens are treated equally in the fight against the pandemic.
The Independent Policing Oversight Authority.
Okay, so we have a video, but also from our survey, we find that 58% of the respondents we interviewed report that the police have used violence in enforcing curfew in their localities. Now, my question is directed to Mr. Danvers Makori. Are the police really justified to use force? And I mean, what should be done if these police are found guilty of actually using force?
Thank you, Maggie. Thanks to Move for the data you supplied and the research you guys are doing. You're doing a fantastic job. Let me just say this: police, by the law anywhere in the world, are given the powers to use force, but that force is within certain legal parameters. Now, what we saw during the curfew enforcement, especially the past few days, that was not justified in any way at all, because force has to be proportionate. Anywhere in the world, if you get somebody who's violating the curfew, for example, you will escort them, logically speaking, take them home, ask them why they're out, and then make sure they get home to begin with. What the police did was not justified in any way, and that is why both the IG, both the CS and the president, first of all, called them out and apologized to Kenyans, because actually, first of all, that's unprecedented. Because what they did was just not legal. There is nowhere what they did was close to legal. You don't beat people, terrorize people, clobber people in the name of enforcing a curfew. You don't break a law to enforce a law. It is nowhere. With what they did was unconstitutional. They broke every law they can think of. So that what they did was unjustified, because these people were not resisting arrest. They were not criminals. No, they were purely just caught up. Now, let me just give you an example of the first night, because I was out there in the evening. And the first day of the curfew, I was in town. I was driving from somewhere for a meeting. And about 4:30, 5 o'clock, all public transport had pretty much ceased. I can tell you there's about thousands of people who were stranded. They had to walk home. I drove through Thika Road. It's like a sea of people, a river of people walking through Thika Road. Now, majority of them got late because of not circumstances beyond of circumstances beyond their help. Now, for police officers to club at these people, to beat these people, to harass these people, was totally unjustified because there's nothing they were doing. There's nothing they could have done that first night. You saw that in Mombasa. We saw that in Nairobi. So, no, what they did was not justified. And that is why both, again, the president had to apologize. And IPOA is following up and investigating that.
Okay, thank you, Dr. Makori. Now, question, when I drive around my side of town, and I've gotten home around 7:10, I have not interacted with the police. Mm-hmm. But we're seeing, in this video, we're seeing instances where 5 minutes to 7, the police are already on the ground. And I've seen quite a number of stories in the media, the police on the ground in the low-income areas, even before 7, I guess looking for people who they can arrest or harass. Is there an overemphasis in the low-income areas by the police?
If you, Tom, in the study just showed about police violence, and I think it was on the last part, the last graph of 81%, and he was asking how comes the other places there isn't people who think there is police brutality and other places there are. Very true. In high-income areas, the suburbs, the Rundas, the Lavington, and unfortunately, that's the reality of our country. There is disappropriate use, even police presence to an extent, because first of all, they don't know who they are stopping, and they're always afraid, and they're always more respectful. Actually, to answer you more precisely, the second and the third night, I was out just monitoring the police enforcement of the curfew. The first night I used my official vehicle, which of course the GK, and then I decided to use my personal vehicle just to go around and see. I went to various places just to see the police response, and it's amazing how the police respond or treat people in different places. And that's an unfortunate part of our story and that's why we're studying this, because in informal settlement, they quite frankly don't care who you are, and they know there's nothing you can do to them, and that is why extrajudicial killing, and Nimas will testify to this, is more rampant in the Korokochos, in Kariobangi, in Mathare, than it is, for example, in Runda, because people don't know their rights, okay? And it's the who's and who's society, they're powerful or connected, or they know somebody, so they'll make a call. And that's why you see that. So they don't want to get in trouble. So they rather go harass the person who, when they harass or they beat up, or they had, there's nothing they can do. They will not report to IPOA. They don't even know there's an IPOA. Okay, they'll just get the beating, go to hospital, or just nurse their wounds in their home, and that's it. They continue. The people who get blackmailed and harassed even more than the people in this return. So it's an unfortunate reality of our country and even our city.
Maggie, if I can just make a quick comment. Maybe one of our panelists can remind me. But given the fact that the curfew is enforced legally, for someone who is found, arrested, taken to court, charged, whatever, for breaking it, what exactly is the fine? How much are people supposed to pay? I don't think there's an imprisonment a penalty for breaking it, but I can't recall. And this raises the question in my mind, have some of these police been told, or just decided on their own at the level of each station, we better go and beat people and make them fear, because if we have to arrest all of these people who are out after 7, we'll have to keep them in custody. The virus will spread because they'll be in close quarters. So it's much better to bash them and make them fear than to actually enforce the curfew according to law, which I presume would be through an arrest and being charged in court. So that's a question. And a final just comment to refer to the data. I'm sure our panelists saw when they went through the results, when we asked the additional question that I didn't mention a minute ago, among the 58% who reported that the police have used force in their locality, in their neighborhoods, we asked those people, do you think the police were justified in using force? And the sample, those among that section of sample, they were split almost half and half. 53% said no, 47% said yes. Now again, to find out what went into the view of here, as we're talking, this 47% who think well and good for the police to use force in enforcing the curfew. Why do they feel that way? Are these people who are more fearful of the virus? Or rather, is it because these are people living in the most high crime areas where they assume, correctly or incorrectly, that people who are out after the curfew comes in force are not simply late going home, but they're looking for shops and other properties where they can rob. So again, this raises other issues as to what informs the contrast in views that we get from our different sections of the sample. Thank you.
I think I can answer some of those questions. Huh? The rules on violations of certain codes that were brought in to help mitigate COVID-19 are under the Public Health Act and under the Public Order Act. Under the Public Health Act, if you found outside an area that you were not supposed to be, the fine, I think, would be 1,000 shillings. Does not have any custodial sentence. However, at the beginning of this curfew, the police were just arresting people and taking them to the cells, or arresting people and even taking them to forced quarantine. There was a lot of issues raised with regard to that, because there was no judicial oversight. Who decided that this person needs to be taken to quarantine in the first place? And under the law, under the Public Health Act, that decision has to be made by a certificate of a health officer and by a court order by a magistrate. That did not happen. But a few weeks ago, the government began taking these people to Kasarani, where they were processed by a magistrate, and the required legal parameters were met. Urban poor areas are over-policed, and apart from that, there's that self-fulfilling prophecy where the high prevalence of crime justifies the high presence of police. However, what happens in that area, those areas, is that people end up being interrupting the criminal justice system, not on actually serious issues, but on petty offenses. So there's a high concentration on arrests on issues like touting, commercial sex work, drunk and disorderly, and things like that, which creates a situation where very many urban poor youth end up interacting so much with the criminal justice system, end up in prison. It's an unfortunate dynamic that we have in this country. But because there's so much crime, there's also support for police presence and police violence in order to control this crime. So that's perhaps that explains that disparity where some Kenyans really support the force that was used.
Okay, Danvas, do you want to weigh in?
I think he's covered it pretty well, but let me just add one more thing. I think on the disparity in terms of enforcement and how public perceived also. You see, the reality in the ground, especially in these low-income areas, is the fact that the police are not there to police, do the proper work as a police force, but mere just they actually, some of them lead the criminal gangs. They use extortion, blackmail. So the high police, and it's not all of them, but the people who are doing an excellent job. I work with them all the time in most of the country. But if you go to these low-income areas, the perception of, if you're to really focus your poll, for example, in, let's say, Korokocho, or let's say Kawangware, or let's just focus there, and I can tell you for a fact, the perception of law enforcement is not particularly good, not because of high crime. I'm talking about majority of people who go out their business, who are just hardworking Kenyan, because the encounter is never positive. Any encounter with law enforcement is intimidating, is threatening, is harassment, is extortion. And when they have a genuine issue to report to, when they have been violated as victims, they are not treated as victims. So they're even harassed more. And so that's a tragedy, especially in these low-income areas. The fact that somebody who's been raped, somebody who's been robbed, or victimized by crime, actually, when they go to seek reprieve through the criminal justice system, they even victimized more by the law enforcement and the system they're actually supposed to protect them. So that's why you see that disparity again there, because the interface between law enforcement and citizenry in this low-income area is rarely positive.
Okay, no wonder we saw on that video about the issues happening to them. Tom, you want to weigh in before? Yeah?
Just very briefly, I don't know if we have any of our friends from Transparency International participating on the webinar, but one of the questions that we didn't include in this survey, and we hope to moving forward, is whether, or to the extent to which, any of these encounters with law enforcement involved a demand for bribery. I don't know if there was any bribery demand involved, not as an alternative perhaps to violence. And by the way, as we were hearing the comments from the two panelists, I couldn't help but think of the current issues in the United States, my home country, about police brutality, especially in the African-American community. As you were speaking about the experience with law enforcement in many of these lower income areas. So this is certainly not just a Kenyan problem, and it's certainly not just a problem during a time of a pandemic. Thanks.
Okay, very interesting. Now, I just want to pick on a conversation that we seem to be hovering around, and it's on the issue of crime. And I want to ask this question to Demas. According to our survey, 90% of the respondents are concerned that crime is increasing within their locality. So we're already saying that these people live in an area where crime could be prevalent, but they're saying because of COVID, crime is increasing. The survey also shows, some of them are saying that because of COVID, people have already started stealing from each other in order to get money to buy food or etc. And I just want to hear your perspective about crime. Is it increasing because people are unemployed? What happens? And if this lockdown continues and the curfew continues, what should we expect moving forward in these areas? Over to you, Demas.
So I think I read somewhere that the government is estimating that there are about 1 million jobs that have been lost in the last 3 months. The siege of movement, the curfew, really has depleted a lot of opportunities for people. Some individuals cannot go out to find work, and some people have to work shorter hours in order to beat curfew. So that's one thing. This generally increases poverty in an area. And where people cannot feed themselves, some would be minded to find alternative means through crime. But there's also the issue of a stretched law enforcement. The police have been massively deployed all over the country, so that you'd find that they may not be as present as they would have been to deal with certain incidences of crime. And that lack of presence also removes the deterrent factor in terms of people seeing that the police are around and they're not engaging in criminal activities. But be that as it may, this has also created sort of a lacuna where the old criminal gangs and have started re-emerging. They've started offering protection, and not just protection, but also charging for this protection. So basically, this is like some mafia-style gangs, and which in itself is a crime. Basically, I think the increase in poverty is one of the factors. Another factor is that about 11,000 petty offenders have been released from our prisons, so that we're able to decongest the prisons to comply with social distancing rules. You can imagine if COVID-19 enters into prison, it might really spread like wildfire and cause a lot of sickness and death. So the National Council of Administration of Justice made this decision to release these 11,000 petty offenders. So these are individuals who've gotten back into the community, have no work for sure, and the opportunities for work are even more scarce. Another measure that the National Council of Administration of Justice did is that it decided that petty offenders were only going to be arrested and upon reaching the police station, be given cash bail, and only those found doing serious things such as murder, sexual and gender-based violence, terrorism, and robbery would be processed further and taken into the court process. But even if you go into the court process, the courts have also scaled down, so that you find that basically the criminal justice system has basically gone to a halt. Meaning that there's a lot of criminal activity happening. The support systems that people used to have, especially victims of sexual and gender-based violence, in terms of civil society organizations dedicated to these things, have also disappeared because of the movement restrictions and the time restrictions. So that particularly victims, women and children who are victims of rape, are finding it very difficult to get assistance. And even when they go to, so you can imagine if this happens at night, you cannot move, and for you to move, you really have to, really have to look for ways in which you can get assistance. So there's a lot of clogging in the criminal justice system, and it might be perceived or might be real that there's a lot of crime going on. Another issue that we have also spoken about here is the crime, but the crime that is perpetrated by some police officers. There has been rampant harassment, brutality, and extortion, especially for issues like not wearing a mask. It is well known in some areas that if you're found not wearing a mask, depending on the area, it's either 500 or 1,000 shillings. And so this is also another form of crime that is going on. The last point is that the oversight authorities that used to check police officers' conduct have not been listed under the essential service providers. So the Independent Police Oversight Authority, the National Commission on Human Rights, the Gender Commission, the Commission on Administration of Justice, civil society organizations who work in the human rights sector, all have to stay at home, or when they go to the office or work, when they go to the office, they have to work within the set hours. So really, the police have been allowed to run amok in terms of how they deal with members of the public. So in my opinion, I think these are the reasons that there has been a proliferation of crime, and also that perception that crime has gone up.
I might mention quickly also that a few years ago, when Maggie and I were working together somewhere else, we used to, from time to time, run a question in our national surveys as to whether the respondent or anyone in their household was going to bed hungry, still hungry. And I recall from that data that in these kinds of low-income areas, even before there was nothing like any COVID-19 then, nearly 50% of our respondents in such low-income areas were saying yes, that either they or somebody in the household or both were going to bed hungry. So the question about hunger and needing to steal in order to survive is again not something entirely new. Whether the increased presence of the police on the streets to enforce the curfew actually decreases the amount of crime taking place is a matter for investigation. But we've seen media reports in many towns around the country. I'm just recalling in Nyeri and in Eldoret and so on, where shopkeepers were complaining that they came out of their houses at 5 in the morning only to find their shop premises broken into and so on. And even when the police posts were nearby, it didn't seem to deter the criminals from making hay. Now, whether those kinds of crimes were taking place, I'm sure some of them were before, but there seems definitely an increase now. And I might say, just as kind of a general point here, speaking also on behalf of TIFA, that we hope in undertaking these surveys that we're stimulating other research among both state bodies and NGOs, other organizations, to go deeper into these problems. Not that solutions are easy, but just that, as Maggie said at the very beginning, that policies that are put in place, to the extent that they can be at least, are based on realities that can be measured and verified.
Okay, thank you very much, Dr. Tom Wolf. What I'm really finding interesting about this conversation is that we researchers collect data, and every time you collect data, you're left with more questions. And this kind of discussion is actually highlighting and responding to some of the questions we have. And as Dr. Tom says, these are things that we need to continuously and always measure to find out the extent of the issues. Now, I just want to move to something different for a while. We've talked a lot about crime. I'm actually concerned that there are 11,000 petty offenders hovering in the streets of Nairobi or Kenya, and that the fact that the courts don't have the time to listen or the capacity to listen to all these cases, and that the fact that the police are stretched and spread out across the country. Really, really worrying information. But I want to now talk about the social economic status of these people. And I just want to direct this question to Dr. Makori. Now, just to remind you some of the statistics in this research, and from what also Tom talked about, 66% of the sample is unemployed. 66% of the sample. And of course, within that 66 are people who lost their job because of COVID-19. Now, the survey also shows that they're having a problem basically financing their livelihoods, and therefore they're having problems buying food, paying rent, and the biggest concern for them is that they are hungry. They don't have money to buy food. Now, in May, which was about 22nd of May, President Uhuru unveiled a stimulus plan, and the amount they were talking about was Kenya shillings 53.7 billion. That was 22nd of May. And you know, there's one thing to talk about economics, and there's one thing to say there's this money that has been availed by government. But the question to you, Dr. Makori, how long will this money take to trickle down to Kenyans, and especially the low-income earners?
Thanks, Maggie. To answer your question directly, then I just give if you allow me to just give a background of what you're talking about. Not anytime soon. Not very many Kenyans understand the budgeting process and how government works. Therefore, when they hear the announcement that 53.7 billion has been set aside, it's a stimulus, I think it's coming tomorrow or next week. Unfortunately, especially where we are right now, we're the tail end of the financial year, which ends actually in June 30th. The budget process is actually very lengthy. It's usually in four main parts: formulation, approval, implementation, and audit. So the formulation and approval part is very lengthy. And once it's been formulated and approved, you pretty much have to stick to that. That's why later there's something called a supplementary budget, because things change and you have to do that. Now, according to the Constitution, only Parliament has the power for appropriations. So as much as the government or the president can say this, the people who legally can authorize it and appropriate that money is Parliament. So we are at the end of a financial year. The money that he's talking about has to be budgeted. It wasn't budgeted initially, so it has to be budgeted. We've already passed the budget policy statement. I think it usually comes in February. So that's one of the steps of approval. So we already passed that. This specific amount of money was not in the budget policy statement. Although a significant portion of that amount was there and will be allocated, wasn't there. So Parliament has to sit, okay, reappropriate this money, reallocate this money. The CS Treasury said that they will reallocate from other parastatals. They already have, I think they have close to 21 billion already available. The rest they will have to look, they have to borrow. So the long short of it, I would say you're looking at earliest August before this money actually gets to where it's supposed to get. September to be practical and knowing how the government works. So because by the time we finish this financial year, then begin the next one, then the money is appropriated. Then it's sold from Treasury to the ground. You're talking about August. The earliest, if it's expedited, can be end of July. But reality is we're talking about August. So unfortunately, that's going to be the reality. Now, given what you've given, the data you've given in terms of unemployment, just to let you know that, you see, in informal settlements, 81% of youth are already unemployed. Okay? You're talking about our nation, especially Nairobi, has one of the highest Gini index in terms of disparity. Prior to this COVID-19, 61% of Nairobians had only 1 meal a day, 61%. So now you can imagine where they are, what's happening right now to them, okay? So that's why you see that on your service, 61% are employed, because in reality, in most of these informal settlements, unemployment is already a sticking point. Now, majority, Dimas has just quoted the people laid off. The figure is 1.2 million people who've lost jobs, okay? Out of the 1.2 million, 1 million are in the informal sector. Majority of them live in the informal settlement. Now you can see that. So already 1 million people, unemployment was already high. Now you've already added 1 million a number to people who are unemployed. So of course you will have issues, and I truly pray there's better communication from a government perspective, especially to manage expectation, because I can tell you for a fact, within 1 month, everybody will be asking what happened to the money, what's happening, and it's not gonna come anytime soon. So for me, it will be prudent for the government to communicate that, yes, this is what the president intends, this is what the plan, and most of it can only come within 2 months from now, given our budget cycle and the process of budgeting in the country.
If I can just add there, one question we did not ask in the first survey, but we've included in the second, is to find out exactly where people were at the time that the Nairobi area travel restriction was announced. Because it was clear from some of the answers we were getting that a small but significant number were actually in their rural homes and couldn't get back. And then in the second round, we're not interviewing them. We're only interviewing people here in Nairobi. But from what was just discussed, Maggie, I think for our third round of the survey, if we get enough funding to go ahead with that, we need to ask people, even in these low-income areas, do you have, or does members of your family have shamba in any rural part of the country where you could at least go during this virus to get direct access to food? Not that food is always ready in the shamba, and we've had a lot of problems with floods and so on. But we could even ask in the next question and in the next survey, over the last year before the virus, about how often was your household receiving any money, any food, either brought from your rural home or sent, or people in Nairobi going up country to come back with it? Because I'm just trying to remember from some past surveys, I've got an idea that somewhere between 60 and 70% of Nairobians have a rural home where they expect to be buried. God forbid we all have to die, but I mean, so people do have, a home in that sense. But in terms of a safety valve or a safety outlet at times of great economic stress, one of the pressures which we know the government is under in terms of this decision on Saturday is that there are many people in Nairobi, and I've met quite a few of them myself, who would like to go home at least for a while because they know there's food there. Now, of course, that on the other side entails potentially spreading the virus. So the government is really in a catch-22 on this, and this is a situation, in many, many parts of the world, but especially in Africa and other low-income areas of the globe, where much of the urban population is poor, but does have a rural home somewhere where they could get access to food. So again, I think this is one of the very, very difficult issues that I think will go into the decision that we're looking forward to hearing this weekend, one way or the other. I don't know if either of the panelists would like to comment on that.
Thank you, Tom. So, upcountry, a source of food or a barrier place? I think that's one of the things that we're pointing out, and whether we can begin to see movement from county to county. I don't know who'd like to take that question, Dr. Makori or Demas?
I can pick it up quickly, and then Demas can chip in too. I had the privilege of working also as the agricultural CC in Nairobi County, albeit briefly. So I do understand the food supply and the food system in the city very well, and how food moves in and out and how Nairobians work. Now, as much as Dr. Tomuf is correct in terms of the percentage of people who have a sort of rural home, the fact of the reality is that rural home is not a source of food supply. Food supply in this nation is very fragmented. Nairobi is the biggest, largest market in terms of volume, and in East Central Africa. However, how food arrives here is part of the challenge we have, and maybe we can talk about later, the food costs and how it affects the urban poor. Now, the reality is, even if they were to go back, it will not be a safety net valve, because if you understand urbanization, the reason people move to urban centers is because to seek opportunity and employment. They have left these places because there's much opportunity. Agricultural returns, the margins are very minimal. Most of the farmers that we have in this country are subsistence farmers, and that's why we still have, we talk about food security till today. This fragmentation of food supply and the food system actually what also affects our food security overall. So in a nutshell, I think I would say, Dr. Wolf, that going back or thinking it will only be to escape paying rent, and then there'll be food is cheaper there, but not because they have a shamba to plow for, so to speak.
Sorry, I didn't mean permanently. I just meant for a couple of days to maybe get some food to bring back to Nairobi. I'm sorry.
Well, actually, I can tell you, it's with my sources having been in that sector. When transport was frozen, public transport, long distance between Nairobi and other parts of the country, what actually has flourished a lot, if you go to the bus stops and bus stages, is people the relatives from across the country are sending food stuff to Nairobi, be it cabbage, be it potatoes, be it corn or maize as it's called here. So it is happening a lot. Food is being sent in through this public transport that was there, because now there's buses have actually, I saw a bus being converted into a lorry, so to speak, so that both parcels and food is transported to Nairobi. But if will it temporarily help? No, I don't think it is temporarily, because the food system in this city is not that efficient, so to speak, so that they can actually go and get back and come a few days. And even the transport cost will be so high that the cost benefit analysis will not even help them to go get food and then come back here.
But
I'm conscious of time because I'd like us to finish in the next 20-25 minutes. So what I would like to do now, I want to do a live poll, meaning we want to get our audience, to give our audience an opportunity to answer some questions. After that, I will start picking questions from the chat and channeling them to the panelists so that we can also hear from the audience. So we're going to do a live poll. I'm going to upload a survey, and I want you to answer the question. The panelists, I'm sorry, you cannot vote. We can only get the votes from the audience. So I'll do the first poll, and you can see it on the screen. And this is touching on what we were talking about. What should happen to those who are caught breaking curfew regulations? Number one, detained to this, in a cell overnight, sent to a quarantine center for 14 days, fined as petty offenders, and then given community service as a punishment. And here we're talking about especially the low-income earners. So people are voting. We're seeing the votes coming in. So if I could just, I want to close the poll, and from the screen I'm seeing that 76%, even more, majority feel that instead of fining them or etc., community service should be the ideal punishment. So that's the first poll. I want to go to the second one. Going to the second one. Sometimes this technology takes a bit of time to show. Okay, I'm going to the next one. We've had a conversation about the police and whether they are justified in using force. So the question is, are they justified to use force? And this question was informed by the fact that Kenyans sometimes can be very interesting. They want to break the law, or they go into the house at 7:30 after the police have patrolled, they leave the houses and continue their lives. So are the police justified in using force to enforce curfew? Again, 92% are saying no, 7% are saying yes. So that is let me end that one. Then I'd like to go to the last question. Dr. Tom Wolf alluded to this. President Uhuru is expected to make an announcement tomorrow, and we were just picking qualitative comments in terms of what people are expecting. And people, basically the question is, what do you think he should address in his speech, or what should he announce? Should the curfew be moved from starting at 7 p.m. to 9 p.m.? Should they remove the restrictions where we can move from one county to another? Reopening of the economy, meaning allowing shops, businesses, hotels, etc. to come back into business, and then give details of how Kenyans will benefit from the stimulus package. We can see the poll coming in, responses are coming in. In fact, people seem to be divided. The bars are shifting every other time somebody votes. So what is it looking like? About 40% are saying the focus should be reopening the economy so that businesses can continue transacting, and therefore money can move and people can get something to earn a living from. Then the second percentage is coming from reducing the curfew so that it starts at 9 p.m. Okay, so now at least we've gotten some feedback from the audience, and I want to pick a question from the audience, and I want to direct it at Dr. Makori. There's a question from the audience, and there's a question from Maurice Minor. He's actually saying there's been conversations where people, especially low-income earners, have been given cash and even food from the government. And we also said that it's going to take a long time for the stimulus package to trickle down to the ordinary Kenyan. But there's been conversations about cash transfers, free money being given, free food being given. And the question is, how effective is it as a way of bridging the gap between now and the time we can begin to see the money coming down to Kenyans?
Thank you, Maggie. I'm a pragmatic individual, so I would say something is better than nothing. And the reality is that money, because I do spend some time in as we say, mashinani. So as much as we do the data and the research and do the policy part, for me, I like the reality on the ground. So that money actually is getting there. People are receiving majority of people are receiving about 1,000 shillings a week, which translates to 4,000 shillings a month. And that is informed by the World Bank data in terms of income per household. That's why that number was arrived at. It is getting there, and it's on this part actually. It is actually helping those now, the urban poor, or not just urban poor, even the rural poor, because it's across the country, and it is able to mitigate to an extent the pain that is there of unemployment or underemployment, or been also become reduced, or didn't have any income to begin with. From an economic perspective, to me, that's the to be done on large scale, in large scale, like for example the US, where people receive, almost all citizens received a check from the IRS, it will have a significant impact on the economy. So for me, it's twofold. Number one, it's helping those individuals or families get by. 1,000 shillings is a lot of money in Korokocho. 1,000 shillings is a lot of money in Kangware. That's food almost for 2 weeks. People don't understand that. You know, for the people in the upper middle class, that's money that you spend for coffee at Java. You understand? But for them, it is money for 2 weeks. So every week, that's a stopgap measure that is actually helping a lot. So I applaud the government for doing that. We have to see the total figures and who and how, so we can have an accountability aspect of it. But what I can confirm on my end is the people in the ground, in the poor, in the slums are getting the money. I've seen it, I've had it, I've interacted with those people. So maybe we can get from the government who the total figures and who got it. And it's even better to finish with this. It's better than giving food, because this you can trace. You can trace so and so was sent money. And that's why we advocated for vouchers or even cash transfers, because we can hold people accountable. Because prior to this, when food is given, it's local administration, the chiefs, this is who are stealing food. The food doesn't get to the poor people who actually need it. They give it to their own friends, and they even sell the same food. So this is a better way. It's a better way of getting money there. Is it perfect? No, it's not. But I assume it's much better than that, and it's actually helping people and also helping the economy.
Okay, thank you very much. I have a question here to Demas. This is from Elijah Rotok, and he just wants a clarification. Initially, we talked about 11,000 petty offenders being released, but he's saying, could you clarify that petty offenders are not supposed to be in prisons, as these offenses are of nuisance in nature? So I think you just need to clarify on that.
Yes. So in fact, this is something that criminal justice reform has really grappled with, because petty offenders are actually people who were found guilty of crimes that do not really hurt or harm any other person. So, for example, if you're found touting, or if you're found drinking, so drunk and disorderly, or commercial sex work. And there's the discussion that these individuals are actually, that Kenya should actually declassify and decriminalize most petty offenses, because they take up so much prison space, they take up so much prosecution and police time, and divert policing, prosecuting, and correctional facilities from the core work in dealing with real serious crimes. The National Council of Administration of Justice did an audit of the criminal justice system in Kenya, and found that about 75% of everyone within the criminal justice system is there because of petty offenses. And they also found that of this 75%, almost 70% of these people are youth, and youth who are poor. So it just goes back to the discussion in which the criminal justice system unfairly targets the already vulnerable and perpetuates their suffering. There is, I think the government is trying to set up a way in which they can start looking at a penal code to remove certain crimes and declassify them, so that they will no longer be used to victimize people. But I know for a fact that the director of public prosecution, sometime late last year, directed his team of prosecutors not to proceed to charge anyone arrested for touting. And this has gone a long way in releasing, the judicial time, and also not penalizing people for trying to actually make a living. Yeah.
Just one quick comment about Dr. Makori's last comment. You may have seen, Dr. Makori, that in the survey that we're discussing today, we asked the question, have you or anyone you know received a mask, food relief, or cash donations? Now that's very imprecise because we don't know how widely someone may know other people in the area or even somewhere else who received food. But in the current survey that, as Maggie said, is underway, we fine-tuned that question to ask, wewe mwenyewe, have you yourself received? So it will be interesting to get back to you in a few days when we have all the data to be able to confirm or refute your suggestion that you gave a moment ago that many people in these areas are actually getting something.
Well, I say many.
So let's keep in touch about that.
Dr. Wolf, I didn't say many. At least I know. I said I know a number of people are getting it.
Well, we'll have more concrete statistical basis for assessing the extent to which such relief is reaching people, and we'll engage you again. Don't worry.
Okay,
right.
Dr. Wolf, I have a question for you now about the data and about wearing masks. Now, in the survey, when we ask the question, are you wearing a mask? We find a very high number of people are saying, yes, I'm wearing a mask, because that's what the regulation is. But when you ask them, are people around you, your neighbors, etc., are they wearing masks? We see a drastic drop in the percentages. So we're seeing a different kind of claimed behavior, which is what I am doing, and then reported behavior based on what others are doing. And I found that part of the survey very, very interesting and contradicting. And maybe Dr. Wolf, if you could explain to us, why would respondents say that I wear a mask, but people around me are not wearing masks?
Well, remember, if you look at the precise data for obeying the curfew as well as wearing a mask, we gave options, that is, in terms of levels of compliance. And we found that overall, only 58% of people said that they wore a mask all the time that they went out. But I think what the participant here is asking is what might explain the level discrepancy between reported compliance by the respondent in the survey and how that respondent is assessing or measuring a compliance out there among people that they see. We have to assume that people generally are less willing to self-report behavior that they think is negative. So there might be a bit of inflation there. I remember after the 2002 election, among those who were registered voters, we asked how many of them had voted. And I think 92% said they'd voted, when we knew from the official statistics that not even 70% of registered voters had voted. So people do like to look like they're good citizens, by and large. And that's why, again, we shouldn't necessarily worship such figures as the whole truth and nothing but the truth, but to look at the trends, because if that level of inflated reporting is basically constant, as we're going to be doing this survey 2, 3, maybe even 4 or 5 times, as long as this regulation is in place, we can assume the inflation level is going to be the same, but we can track the trend on this. But I think in general, we can agree that people might be more likely to be entirely honest in reporting the behavior of others. We know from other surveys in many other countries, it's more likely to get accurate figures when you ask someone, do you have any friends who use drugs? Rather than asking, and now, mwenyewe, are you doing something illegal like that? So that's just something we learned from doing research. So it's a good point.
Okay, I just want to pick one question from the audience, and then after that we can wrap it up. So I have a question here from Mohammed Gure, and he says, to become a doctor, you're required to go to med school for 6 to 7 years, but for you to become a policeman, you only need to finish high school and you go through a 9 to 11 months of training. And his question reads, should the term for police training be increased and the term for acquiring a firearm be increased in order to earn it? Maybe we can hear from Demas and then any other of the panelists who would like to chip in.
I think the problem with policing in Kenya is not really rooted in how long they're trained, but in a culture that has been there. We inherited a police service or a police force, as it was called, that was designed to preserve the colonial state, to preserve the crown. And when we gained independence, I think we failed to engineer it. So instead of preserving the crown, it was designed to preserve the regime. And whenever a service like that is set up to preserve the regime, I think there's a tendency to look the other way and to allow them to supplement their income through things like corruption and things like that. So this is something that has gone on for so many years. And we all know that there are officers who are not these students. There are officers who are quite qualified to even to be lawyers and to be other things. In my opinion, it's not about that. It's about a culture that is very hard to root out. I'm sorry, and ideally, policing should be a collaboration between the officers and communities. This thing called community policing, I think is just what we have not gotten correctly. Because if in our work we usually realize that there are certain areas where the communities and the police live in harmony, and you realize that the people there made a point to know and interact with the police and the police leadership there. And so that policing is now a collaboration between members of the public and the police. They report things, they give them information. And when you combine community policing and intelligence-based policing, you find that a policeman is less likely to beat you up, is less likely to brutalize anyone because he feels ownership of that community.
I mean, I couldn't agree actually with Dimas. Let me just say this: the first emotion an average Kenyan they have when they see a police is fear or anxiety. It's not positive. The moment you see police, just there's fear and anxiety. It's not happy or oh, I'm safe. Now, in as much as the world is seeing what's happening in America because of the killing of George Floyd, but see, that's not the reality. I mean, yes, that was wrong. But for the most part, I spent most of my life there, and I can tell you for a fact, when you see a police officer, you feel safe. You don't fear. You're okay. You don't fear them because they're public servant. So the culture of policing, the perception is very different. Now, in parts of this country, my job, a lot of my work is in conflict areas and regions, North Rift, the isolated areas, and in places where there has been effective policing, for lack of a better word, is where there is what Dimas has said is community policing, where the interaction between the police, the intervention police, and the public is very positive, and they're doing a fantastic job. I can tell you for a fact, if you go in other places of the country, I mean, there are some police officers who are doing a phenomenal job. They have put their life on the line. They have shed off this idea of force and I'm the big person, I'm here with a big stick to beat you, but I'm here to protect you and serve you. And it is far more effective. So I truly agree with Dimas. It's a change of culture. Although, let me just put it this way, there was an improvement from the Moi era's police to now. I mean, there's a major improvement. The police reforms actually made a difference. They do understand the Constitution. They do respect, for the most part, the rule of law. They're more careful. They must have maybe you have data in terms of extrajudicial killing, but at least they're more careful in how they interact with the common man. So there's an improvement. So let me just give credit to HDU. There's an improvement from where they were to right now, but we still have a long way to go. So if you've gone to Europe, if you've gone to Asia, the police are servants. You see them, you feel safe, you feel okay. Not here. So until we get there, that's what it's going to take.
Okay, so definitely not here or in America, as Dr. Wolf indicated earlier. So thank you very much. I just want to wrap up this session. And in terms of wrapping up, I would like to ask each panelist to basically give the reflection of, in the next 1 month, what should we expect? You can talk about Kenyans, you can talk about the low-income earners, or generally. Just give your prediction, make it short and punchy, then we can wrap up this session. So I'll start with Demas, then I'll go to Danvers, and then to Dr. Tomo. So Demas, over to you. You're muted. Unmute.
Sorry. So currently, as we're speaking, there's a meeting going on at the Kenya School of Government between security sector heads. So from the CS to the head of the anti-terrorism unit to the Inspector General and his deputies, and they are meeting civil society organizations, basically to discuss what can be done to deal with this issue of police brutality, police violence. And from their point of view, they're trying to say that there are bad apples and they need to be rooted out, but they want to avoid a situation where the police are vilified wholesalely. Because, for example, if the police decide to go on a go-slow for even 2 days, you can imagine what will happen. So mine is just to hope that that meeting will be fruitful, and it will really push the needle towards justice, towards police officers who look at communities, especially poor communities, as people and not as animals to be used or to be terrorized. Thank you.
Thank you.
What do you expect to see in next 1 month? I expect to see the first intervention, monetary policy by the central bank starts actually to kick in and bear fruit. The reducing of the CRR, the cash reserve ratio, the reducing of interest rate to 7.5%. That is when I think it will come to, for lack of a better, salvage the economy. I predict that. I think for me there is some resiliency to us as a people, and even to the economy. There's some resiliency to it to an extent, and then given the early interventions, that's when we will see it work. However, that's on the positive side. On the negative side, I expect to see the full effect of the partial or restriction of movement and partial lockdown of the economy really come to fruition to the middle and low income earners, because now this is most companies that had their cash reserves are exhausted, they cannot pay anymore. More people are going to be laid off. People who had the credits from the banks that the banks cannot credit anymore. So I expect to see now the full cycle of rent not being paid. The KNBS was 51%. I think maybe 61% people won't be able to pay. So there's going to be hardship for individual people, but overall, I think the economy is resilient. So what the initial monetary policy intervention came in, even the fiscal policy, I think fiscal policy rather will help to soften the hard landing that we'll be experiencing. That's what I expect.
Thank you very much, Dr. Wolf.
Well, I'll have to duck your question in the sense that my expectations, to a large extent, will depend on what decision we hear over the weekend. We've seen, for example, in the last couple of days, major riots. I think they were in Dakar in Senegal, in response to an even more severe lockdown than we have in Nairobi. And I'm sure the decision makers in government know there's only a certain level to which, especially the people included in our survey, can continue to tolerate these, the economic consequences of the measures in place to combat the virus. So the last thing I would want to be at the moment is a decision maker in this government or any government to have to make this choice of continuing or even increasing the measures in place to combat the virus on the one hand, and versus releasing them to mitigate the impact of those measures, or releasing them. We saw just also this week, the chief medical advisor to the government of Sweden had confessed on BBC Heart Talk that he was wrong. And that's why we've had such a large number of fatalities in Sweden, especially in care homes of the aged, compared to all of their surrounding Nordic countries, where they just allowed people to a much greater extent to continue their normal routines of social interaction. And this, as I said, led to the invasion of the virus, especially to more vulnerable populations. So the government is really between a rock and a hard place. We've seen, as I said before, in the news media for the last month or more, many people being interviewed, saying, afadhali nife na njaa kuliko kuliwa na hiyo virusi. And that's, so does the government have to say, we have to relax temporarily, let the virus spread, kill more people, and then we can go back to a lockdown that people will appreciate better because they have more fear of the virus? I mean, that's a terrible policy decision to have to take, but you just wonder, what the choices are. But let me just end by saying, however difficult these choices are, how can we, and I mean the four of us today, as well as everybody who's listening, get the maximum benefit of surveys like this, so that both government and non-state actors can be basing whatever decisions, difficult decisions they have to make, more on the basis of tracking the realities that are out there. And I'm sure Maggie would agree with me, and also our panelist colleagues, from where they sit, that the more information that they can get, the better. So at least people know what the consequences are of the actions that are taken, or deferred or not taken. People at the end of the day who are holding responsibilities, and that includes us doing research, have to be responsible for the work that we do.
Thank you very much, Mr. Tom. We've come to the end of the session, and first I'd just like to thank the panelists. I just feel that the session was too short. There's so much information you have. You've actually given us content for the next questionnaire. You've answered questions that we had, and you've actually put context to the research that we're doing, and I really want to thank you for that. I'm hoping that if the economy is open, I can buy you coffee or lunch, and we can continue this conversation, because I really loved the insights. I also would like to appreciate the people who attended this webinar. They have been contributing, asking questions, and voting. I thank you very much. I saw a question here from Mr. Kiare asking, will we get a copy of the video? Yes, we're going to load it on YouTube and send you a link, and you'll be able to see the deliberations. As I conclude, I just want to say, look out for the report for round 2 that is likely to be published next week. We'll actually be showing you information on what has changed in terms of the indicators we've been tracking. Look out for it, share it with people you know. And as Dr. Tom Wolf said initially, please look at the crosstabs, look at how you can use the data, and also let's move this document from research into actual action, which is policy. With those few remarks, I'd just like to thank you very much, and wish you a good afternoon. It's already 12:08, and wish you a fantastic weekend. Thank you very much.
Okay.
Thanks, everyone. Thanks, everyone.